Uganda first detected a case of monkeypox on the 24th of July 2024, allegedly imported from the Democratic Republic of Congo. 3 months after the outbreak, 164 cases and 1 death have been confirmed.
Of the 19 districts, up to 10 districts are currently in active monkeypox transmission. All regions except the region of Karamoja have reported monkeypox cases. Since the beginning, even before the World Health Organization declared monkeypox a public health emergency of international concern, Uganda, through the Ministry of Health, had taken this outbreak with great concern and seriousness it deserves.
It's transmitted by close, intimate contact in different ways. It might be between couples, but it can also be between a mother and a child. So it is in those when it gets into children.
Prime Minister Robinah Nabbanja says the outbreak has affected Uganda's tourism sector.
Has a negative implications to our economy, specifically our tourism sector, where nations continue to issue travel advisories to travelers visiting Uganda. This is the expense of our transparency and in working in conformity with the international health regulations.
Outbreak. That is why we have this high-level mission, and they are coming really just because of solidarity with Uganda and appreciating what you are doing and the whole government.
Firstly, is really to acknowledge the leadership of Uganda, not just for Mpox, this outbreak, but you've always shown leadership in the work we do in public health. You know, I can trace it back to the peak of the HIV situation, to every single emergency system. So Uganda is really a symbol.
But as the country grapples to combat the monkeypox epidemic, the World Health Organization has set up funds to support Uganda in the fight against the monkeypox. WHO Deputy Executive Director in charge of health emergencies, Dr. Chikwe Ihekweahu, today informed the Prime Minister Robinah Nabbanja that WHO has identified funds from the pandemic fund to deal with the problem.
And you know, you mentioned some support, and we've, I think, already identified some resources, and there are others. You know, other working with other partners. Recent opportunity. There's something we call the Pandemic Fund that has devoted some resources to multi-country proposals, and some of that will be dedicated to the response through the colleague. But
however, Dr. Chikwe did not disclose how much Uganda will be given to deal with the monkeypox disease. Meanwhile, the government has agreed to lower down the electricity tariff to tea processors to 5 cents to allow the sector revamp from the current tea crisis. The State Minister for Energy, Opoloto Okasai, made this commitment today during a meeting with the tea farmers, processors, and the Prime Minister of Uganda Robinah Nabbanja.
In February, we shall have a tariff which is favorable for tea production.
The Premier convened a meeting following a directive from the President in order to avert the tea crisis in Uganda. The President is concerned that Uganda's tea is fetching the lowest price on the international market, resulting from poor harvest by the farmers and high cost of the power.
We are looking at, at the crisis we have now, is the issue of price. The tea farmer is getting such a raw deal, 200 shillings a kilogram. We must address that because the people who are involved in the tea are collapsing.
The critical driver of price in a market is quality. Let's not beat about the bush. What drives the quality of leaf and the product take Mombasa? It is the fertilizer, even if you take 2 bags.
And so we all agree in the cabinet that we should have a tea policy to regulate tea farmers.
Uganda has 35 tea factories, but 2 factories have since closed shop because of the high cost of electricity. Farmers in Uganda have also planted 50,000 hectares of tea. Because of the low prices, tea farmers recently threatened to cut down their plantations and plant other crops. In an effort to revamp the sector, Government of Uganda needs 41 billion shillings to purchase fertilizers for the tea growers in Uganda.